Welcome to Employment Law This Week. I'm George Whipple. The COVID-19 public health emergency officially ends tomorrow, May 11th. Employers across the U.S. are now faced with new decisions about policies, procedures, and benefits, a transition process that began on April 10th following the end of the national health emergency. Epstein, Becker Green's Brianna, Richardson, and Emanuelson tell us more.
The end of the public health emergency also means the end of some last remaining COVID-related federal requirements, including the requirement for federal government employees and federal contractors to be vaccinated for COVID-19. Also important for private employers is that insurance companies will no longer be required to waive or provide free COVID-19 testing.
If you take one thing away from my entire benefits spiel, it's to be in contact with your vendors, your insurers, your COBRA administrators, and your third-party administrators. And that's because you're about to be in a transitional period, especially with the national health emergency. The national health emergency has been pausing or tolling deadlines, especially COBRA deadlines, HIPAA special enrollment deadlines, ERISA claims, and appeals deadlines. The end of the public health emergency means you have some decisions to make. So the public health emergency originally mandated coverage of COVID testing related services, and COVID vaccinations in and out of network without cost sharing. Now, once this emergency ends, the only required coverage will be that non-grandfathered plans will still have to cover COVID immunizations, but only in network. Now, just because the public health emergency ended doesn't mean that you have to stop actually providing these under your plan. So now might be a nice time to take a look at your plan and decide if you want to continue to offer these services to participants. And if you do, coordinate with your insurer.
The end of the federal public health emergency is expected to have some effects on certain employer policies and procedures, especially for employers in states that continue to require paid leave while the public health emergency was in effect. For example, states like Colorado have tied their paid leave requirements specifically to the declaration of a public health emergency on either the state, local, or federal level.
Thanks, Brianna and Eric, and thank you very much for watching. We'll see you next time.